also gallbladder related disorders. However, this is the earth point, isn't it? Air, water, wood, fire, earth point, but earth point is indicating because of the excessiveness accumulation of the calcium deposits, also reason to cause the gallstones. So that time we can use this point to dispel that, because this goes to the stomach, from the stomach it goes to the small intestine, from the small intestine it goes to the jejunum, ileum, cecum, ascending colon, transverse colon, descending colon, sigmoid colon, rectum. Through that the gallbladder stones will going to slowly come out. If the CBD is clear, the gallbladder stones in the fundus, or maybe it is coming down to the cystic duct, from the cystic duct it comes to the bile duct, from the bile duct it comes to the duodenum, from the duodenum it passing slowly to the colon, from the colon it is coming out. If it is less than 8 mm or the 10 mm gallstone is there. If there is the problem is excess, more than 2 centimeters or 3 centimeters, that is a bigger level, sometimes we'll think about the cholecystectomy is advisable. But however, before that we can try this point. Along with that, it's advisable to use, is the most imperative point. Now you can see there is a 1.5 chone distal, but whenever the patient finds there is a pain on my hypochondriac region, on my below the chest region on the right side, patient is complaining, I do have the pain in this region, then you can recognize, apply the needle. Apply the needle, you try to find out, give the pressure 1, 2, 3, 4, 5. You try to check out whether you have the pain now, whether you have the pain now, whether you have the pain now. No. But if there is the gallstone is there, same pressure you just give over this region, then the patient says, yes, I do have the pain in this region, that indicating there is a gallbladder stones. But sometimes even I recognize in that way, I just try to find out, when the patient is complaining abdominal pain, maybe on the right side he have the more predominant pain, then I recognize there is a pain on this region, indicating there is a cholelithiasis. There is a GB21 pain is there, then there is a cholelithiasis. Then you can recognize, apply that GB21, apply on the Dannang point. Dan means is the gallbladder, Dannang is the alarm point for the gallbladder related issues. Once you activate this point strongly, then when we do the ultrasound scanning, then we try to find out how the gallbladder stones are moving from one direction to the another direction, that is slowly wanted to come out from the fundus, from the fundus to the cystic duct, from the cystic duct to the CBD area, from the CBD it's come down to the bile duct with the support of the common hepatic duct, and then further it comes down to the lower portion, which is slowly the bile is pushing to the downwards direction, then further it's moving to the downwards direction. Chances are there, but without surgery that chances are there to come down if there is a less than 8 mm. If it is more predominantly is there, then surgery is recommended. Hopefully you just apply the Dannang point. So Dannang point, when this is as a extraordinary point to be known as a new innovative point to be known as a Dannang point. There is no extra number, but you remember as a Dannang. Now let me see, there is another point to be known as a from here you can recognize the lateral malleolus. First we will see, and this is the internal malleolus, this is the medial malleolus, this is a lateral malleolus. Lateral malleolus is nothing but head of the, this is the head of the fibula, this is the termination of the fibula region. Right, from here you just come, proximal. Proximal means above, this is the tip. From the tip and then proximal, this is as a 3 chone. How many chone? This is the tip of the lateral malleolus. From the tip of the lateral malleolus, again 3 chone plus 3 chone, 6 chone, then 7 chone. 7 chone proximal. From here to here also we measure. From here to here how many chone? 6. Yeah, it is the 19 chone. From here to here is 19. From here to here is 16 chone. From inside is 13 chone. From here to here is 16 chone. Then you come down, this is the center, this how many? 8 chone. Then again it is 7 chone, 1 chone below you just come down, this as a 7 chone. Then you make it as a 3, again make it as a 3, 6 chone plus 1 chone is a 7 chone. But now 7 chone, this particular region, there is the head of the, this is the fibula, this is the fibula bone. Now the points are located posterior to the fibula, then anterior to the fibula. The posterior to the fibula, this is the GB34, 35 point is located in this region. 35 point is located So you just apply this point. GB35 is the white Yang Chio. Yang Chio point is the C cleft point for the in-way regulating vessel. That means is the do you know there is a meridian called as a yang way and then in-way regulating vessel. So that to be known as a Sanjiao 5. Sanjiao 5 is the yang regulating vessel. This also yang regulating vessel, C cleft point. C cleft point for this, but you can use it for the sciatica pain, this also, and further you can use it is the where is the bone? This is the bone. The anterior to this bone, this to be known as a Wai Chu, that is the gallbladder 36 point. This is the C cleft point of the gallbladder. This is the C cleft point of the extraordinary vessel, but this point to be known as a gallbladder C cleft point for emergency condition related to the gallbladder regulating function to be taken place. Now come to this region. Now this is the tip of the lateral malleolus. You come down fortune proximal to this region. This to be known as a fortune 5 chun. 5 chun proximal to this region. 3, 4, 5 chun proximal to this region. This point to be known as anterior to the border of the fibula. This to be considered as a Kuang Ming. Kuang means is the eyes, Ming means is the brightness. So therefore the brightness of the eyes to be taken place. This is the distal point for the vision system. No doubt the Mu Chuang is the window of the heaven. That means window of the eyes you are using is the gallbladder 16 point. Along with that you just add up this point and the GB20 and then GB37 point, also treatable for all the vision related disorders. By the way, this also good point to treat for the luvo connecting point or the nexary point or the copulo conventary point or the communicating point. Interior and exterior relationship is the binding point. Further this meeting point to the liver and then gallbladder together. So hopefully you can understand this is the GB34, GB37 is the luvo connecting point. That's called as a Kuang Ming. Now the next point, coming points are very imperative point. Now let me see this another point to be known as a GB36. No, GB38, that's called as a Yang Fu. Yang Fu point is fortune proximal, 3 plus 1 chun, fortune proximal to this point to be known as a Yang Fu. Remember, Yang Fu GB38 is equivalent to the Sanjiao 3 and then SI3, Chung Su and then Huxi point. Remember, this point is treating for the upper geo. Upper geo means is the head and neck related disorders and also distal point for the neck as well. So remember this, the GB38 is the, authors has written, this is for the 100 joints related disorders. What? 100 different joints related disorders can be treatable by activating the, Yang Fu point, that is the GB38 point. So therefore it's a very imperative point because that's communicating to the gallbladder Sanjiao 3 and then SI3. So that is treating for the head and neck region and also spinal cord region. So therefore this imperative point to treat for the joints related disorders. Now is the most foremost point that to be known as the Swan Chung, that is the GB39. Where exactly this point is located? 3 chun proximal to this region, and then you can find out the two tendons. One tendon to be known as a peroneus longus, the other tendon to be known as a peroneus brevis tendon. Midway between these two tendons you can find, from here 3 chun proximal, you touch and then feel the tendon. This called as a peroneus longus, peroneus brevis muscles. These muscles are the gastrocnemius muscles, these muscles are the soleus muscles. But this point is good point to treat for the bone marrow. You just apply the needle in between the two tendons. Yes, in between the two tendons, you just apply 1 chun distal to this region. Yes, exactly in this region where the pericardium 6 point is located on the palmaris longus and flexor carpi radialis tendon. Like that, this point also located on the two tendons. Right. So you just apply the deeper level. Some authors write, because of the difficulty of this point, they just mention the point is located on the posterior border of the fibula as well. But I too strongly recognize that the point is located midway between the two tendons, because in between the two tendon is connecting to the bone system. When the bone need to strengthen to increase the bone marrow, the bone marrow is the red bone marrow, again is the yellow bone marrow. Both the bone marrow is required to increase the erythrocytes and leukocytes, thrombocytes. It is a red blood corpuscles, white blood corpuscles, and then platelets are required to strengthen. Once you activate this point, but obviously required to strengthen the overall bone marrow system, where exactly the stem cells to be activated by activating this point as per my recognition. But once this point is strengthening to the bone marrow, you know, there is a inside of the bone marrow is good, then your bone also good. Your bone and bone marrow is good, the C of the marrow, brain marrow also good. If this marrow is good, then the anemia may not be iron deficiency anemia, or the iron binding capacity is not too good, and also there is a hemoglobin level, ferritin level. This having any kind of the iron deficiency of the anemia, or may when the normocytic normotropic anemia is anything related to the anemia condition, you remember this point need to be activated. Along with that is the K shoe. K means the blood, shoe means is the point, where the UB17 point also advisable to activate. Along with this point is good point to treat for the overall enthusiasm, to treat for the improvement of the blood conditions. Now hopefully this point also distal point for the head and neck region. When the head and neck having the pain, neck pain especially, then use the distal point. By the way, this also good point to treat for the hip related disorders as well. So hopefully you understand. Now coming point to the next place. Thank you. Then the gallbladder 39, gallbladder 40 point to be known as a Chicxulub, where that point is located. Now I draw the two lines. This is the lateral malleolus. The below the lateral malleolus, you just bring down. This is the lateral malleolus. Then further, this is the place where exactly the anterior to this lateral malleolus. So in between these two, there where the meeting point of the two lines, that to be known as a gallbladder 40, that to be known as a gallbladder 40, that to be known as a Chicxulub. You just apply perpendicularly this point, but this point is the source point of the gallbladder meridian. Which point? It is the source point. Which is the lower connecting point of the gallbladder? Very good. 30? 37. 37 is the lower connecting point, and then source point to be known as a GB40. Maybe this will come in your examination as well. Now we will see, this is the gallbladder 41 is the most imperative points are coming down now. You just use the spirit. GB41, we just use it now as a, these are the tendons. What are the tendons? This is the extensor pollicis longus tendons. These are the tendons, 1, 2, 3, 4 tendons. This is the distal to the fifth extensor pollicis longus tendon, but this tendon to be known as a GB41, just distal at the base of the fourth and then fifth metatarsal bone in the depression anterior to the cuboid bone. Right, you just apply this in the downwards direction for the tonification. You just find out, see, you pull like this, you can find the tendon. In the tendon, you just come down in the depression. Yes, in this depression, you just apply towards the tonification. This point is the great point to treat for all the ear-related disorders and also breast-related disorder. Distal point for the breast to be known as a GB41. Along with that is the Shauza-Sanjo 1 point. Along SI 1 point. Along with that, you can use GB41 point, also good point to treat for the mammary gland or the breast-related disorders. And further, there is a auriculo ear related problem. We can add up this point. By the way, this point is the horary point of the gallbladder as well. Horary point of the gallbladder without disturbing to any other organ. We are activating to the gallbladder directly by using this specific point. Now the coming point is really good point, but now 1.5 chun proximal to the web margin, that to be known as a divuhui. 1.5 chun proximal to this region, you just apply the point, divuhui point, that is GB 42 point. This good point to treat for the gallbladder, especially the bile duct to be taken place by activating this point. Right, now we are coming to the cystic duct. We can use the point that's called as a chachi yaad rakhna, that's called as a XI. That's pronunciation is chachi, but the writing is siasi, XI. Half chun proximal to the web margin, but this also coincidentally connecting to the point to be known as a pa feng. Pa means 8, feng means is the wind point. This is the pa feng, this is the liver 2, ST44 knee. This is the extra point, and this is as a chachi point. 4 points to be known as a this one toe, the another leg to be known as a 4 points. This also good point for the people who unable to live, unable to move the joints of the toes. That time we can use it this point. Then the last point, but definitely having the great impact, we can use it the point to be known as a GB44 is the last point. GB44 is the last point. We can recognize that to be known as a Su Chio In. You just apply as a yes, tonification direction. Yes, now we are tonifying to the very good, enough. Gallbladder 44 is the Su Chio In. The To Chio In is the point to be known as a gallbladder 11 is the To Chio In, but this is as a Su Chio In or the foot Chio In. So hopefully GB44 is the grandmother point of the gallbladder, which is connecting to the large intestine as well. Large intestine 3 Sanjian is equivalent to the Su Chio In gallbladder 44 point. So therefore this point is really great point to treat for all the sense organ related disorders, but it is an emergency point to treat for the gallbladder as well. If there is a gallbladder pain or something, gallstones, that situation also we can use it this point. But by the way, this is an important point. When you can use the first point and then last point will be a good point to treat for the gallbladder, which is the entry point of the gallbladder. That's Tungzilio gallbladder 1, which is the exit point of the gallbladder, GB44. However, the exit point also to be known as a Su Linchi, that is the gallbladder 41, and again it is from the 41 the energy is going and communicating to the Tatun, that is the liver 1 also.
Why is this not the liver connecting point?
Which point?
The 41.
No, that is the interior and exterior relationship. This is the meridian connecting point is this, but this is the different and this is the different. Yes. So hopefully this to be considered as a exit point. You write down 2 exit points. One is the GB41 or the GB44. Both the answer are correct. So hopefully we completed the entire gallbladder meridian. I'll try to wind up now.